Starting on ART early can lead the children to live a very healthy and quality life. I am Syed Sarmadali and you are watching MedScenarios. Today we are going to discuss HIV screening for children below 18 months. So it is done via DNA PCR, which is a virological test, and it should be done for every child who is at the risk of getting HIV from the mother. So it is done by the dried blood spot specimen, and there are times, like there are 3 times you have to do DNA PCR for the screening for the test for HIV testing for infants, right? So for the first DNA PCR test, it should be done at 6 weeks of age, or the earliest opportunity thereafter. It could be 4 to 6 weeks. Then the other one will be tested at the 9 months of age, irrespective of breastfeeding status. And the third PCR test should be done 6 weeks after the cessation of breastfeeding. Okay, so if the child status is positive, then there should be the starting of ART for that child. Okay, and the confirmatory DNA PCR test should be the specimen should be taken via dried blood spot on the day when you have to start the ART regimen for the child. Okay, if the status is negative, the child's DNA PCR status is negative for the first time when it was done between fourth to sixth week, then you have to go, and the child is still breastfeeding, then you have to go for the second DNA PCR test. Although it is irrespective, but it becomes very important when the child is breastfeeding. So then there is the another DNA PCR test at the 9 months, and then there will be the third one after the cessation of breastfeeding, the 6 weeks after the cessation of breastfeeding. After that, when these three tests are negative, then there will be a final rapid antibody test, which will be performed at 18 months using the national HIV testing algorithm. Okay, so there is a small note on it that the rapid HIV antibody test can be used to establish if an infant exposed to HIV um, comes to you without the biological mother. So you can test if it is reactive. Then the child is exposed to HIV, not infected. So just start the cotrimoxazole and check for DNA PCR afterwards. So moving on to the slide, there is the testing algorithm, and it is divided upon the status of the mother, the HIV status of the mother. So we have three of them: negative, unknown, and positive. If the mother status is negative, then the child, that infant, is negative. You just have to do nothing. And then if there is the mother status is unknown, just go for the rapid antibody test. And if the mother status is negative, then the infant is obviously negative. But if the mother status is positive, and like the mother is also, like, she is known to be positive before, so you just have to do for it first DNA PCR test at 4 to 6 weeks. Okay, and after that, if it is positive, if the first DNA PCR test is positive, then you go for the ART clinic to get initiated on antiretroviral treatment. Okay, next thing is, if the status of the child is negative for the first DNA PCR, and the child breastfed for within the 6th week, within the 6 weeks, right? So go for another DNA PCR at the 9 months. If it is positive, start on the ART, right? Link to the ART clinic. And if it is negative, then go for the third PCR test, which will be done at 18 months. And this thing here, you advise the mother to breastfeed the child for up to 1 year. If it is positive, then link the infant to ART clinic. And if it is negative, then obviously the child is negative. Here we conclude the today's topic for HIV screening for the children who are below 18 months. Thank you.